If your doctor has advised you knee replacement surgery, then this video is for you. In this video, we'll be answering all the questions related to knee replacement surgery that you get as a patient before opting for the surgery. So, you must be scared about knee replacement surgery as an operation. Like how much pain is it going to cause you, what kind of implant they are going to put in your body, or what about the rehabilitation and the recovery process. So before you make a decision, watch this video till the end because it will clear all your doubts. The first thing is, knee replacement, is it the only option for me? Or you might think, do I really need knee replacement or can I go for something else? Sometimes one more myth is there that I am too old or is my age correct for the surgery? Next, people always get this question in their mind, I won't be able to walk after surgery or what is my life going to be? Next, patients, they always worry about whether my entire knee is going to be replaced or only a part of it, or how much pain I am going to get after the surgery, or which is the best implant for me to undergo this surgery, and how long is the recovery period or rehabilitation going to be. So let's start with the first question. First is knee replacement the only option for me or if there is any other way out? So knee replacement is normally the last option. Initially, majority of the patients, they can be managed by weight reduction, physiotherapy and exercises, or cartilage regenerating medicines or lifestyle modification. If these things are not working, then your doctor might suggest you injections. If nothing is working, and after that also you are having severe knee pain or you are not able to walk well, like say till 6 months ago you are able to walk for 30 minutes and now you are only able to walk for 10 minutes because of knee pain. That is a sign that knee arthritis is increasing. Or if you are having difficulty in climbing stairs, or at night even while turning in the bed you are getting knee pain, or if your legs are becoming bow, or like the English alphabet O, that means you are developing genu varum deformity because of knee arthritis. Or when you get up in the morning, you get significant swelling and pain in your knee, and you are not able to do your daily activities like going to kitchen or going for your evening walk or morning walk, or if you are going for somebody's marriage, you have to think whether I should go or not, whether I'll get a chair there to sit or not because I cannot stand and have my lunch or dinner there, then of course that means your lifestyle is getting significantly affected. Normally we are able to do knee replacement surgery very well till the age of 85 if the person's overall health condition is good, if heart, lung, liver, all the major organs are working fine, if the patient is able to tolerate general anesthesia well, and overall the fitness level of the patient is okay and muscle strength is good, then we are able to operate all the patients till the age of 85. Normally, after the age of 70, we do one knee replacement surgery at a time. That means we don't rush for doing both knee together. We operate one knee, then we wait for few days and then we operate the other knee. So that is one precaution that we take at our institute when we are operating both knees for a osteoarthritic patient in age more than 70 years. Next big question is, what about walking after knee replacement surgery? So normally all our patients are able to walk within 24 hours of knee replacement surgery with the help of a walker. Our expert team of physiotherapists, they help the patient to come out of the bed and walk. Most of the patients are able to walk well with the help of walker for first 7 to 10 days, and after that they are able to get rid of walker itself. And household ambulation, that means inside house walking, is normally, it becomes normal within first 3 weeks. And if you want to go out for walks, say morning walk or evening walk outside your house, most of the patients are able to do that within 1 month. Next big question is, will the doctor replace my full knee or half knee? Now, it's not that always full knee replacement is required. If only one compartment of the knee is involved, say the inner compartment which is known as medial compartment and the outer compartment is normal, then we might go for something which is known as half knee replacement surgery or unicondylar knee replacement surgery. So this your doctor will decide based on your age, your knee x-ray, the whole body x-ray, and also sometimes MRI is required to make this decision. Next important question is, how painful is knee replacement surgery? Now, by using a multimodal pain control, we are able to reduce the pain by almost 80%. We use a special catheter in the spine to reduce the pain of the patient. Plus, we give intravenous medicines and also pain patches. This reduces the overall pain of the patient. It makes the patient so comfortable that on day one after knee replacement, the patient is able to sleep well. Next important question is, which is the best implant for my knee? There are very good Indian companies making good knee implants. Also, in Indian market, we have some of the top brands of the world from America and UK with very good case research and history as far as the knee replacement surgery goes. But your doctor will select the final implant based on 4 factors: your age, your existing bone quality, deformity of your knee, and your activity level. So based on these 4 factors, the doctor might select an implant from some American company or Indian company or some European company. Next important question is, how long is the recovery period? So the walking or the recovery starts within 24 hours. Most of the patients, they become ambulatory with the help of walker by the time they are able to go back home from the hospital. And most of them are able to let go the walker by 7 to 10 days. By 15th day, we remove the sutures from the knee. By 3 weeks, most of the patients are comfortable walking inside the house. And by 4 weeks, most of them are comfortable to go out for morning and evening walk. Now, what are the things that you can do before going for knee replacement surgery? One thing which is very important is you should control your pre-existing diseases. That means if you have sugar, that means diabetes, you should take your regular diabetic medicines and you should cut down sugar in your diet. Next is you should take your regular blood pressure medicines if required, or if you have a pre-existing thyroid problem, then you should take thyroid medicines also. Also, you should stop smoking. Next important thing is you should try to reduce your weight if possible. Fourth is, before knee replacement surgery, you should definitely start doing quadriceps and hamstring strengthening exercises at home. This will improve your post-surgery recovery tremendously. Now, you should discuss all these points very openly with your surgeon. I encourage all my patients to discuss these things with me before surgery. That, is knee replacement the last option for me? Are you going to do it for one knee or for both the knees? What implant are you going to use? What are the possible benefits and risks associated with the surgery? And I give them a very realistic expectation about the recovery process and rehabilitation. So, knee replacement surgery is not just a mechanical process of changing the joint. It is about reducing your pain, correcting the deformity, restoring mobility, and helping you get back to your life in an independent way. So, take care of your knees, but if at all your life is becoming difficult, meet your surgeon, discuss all these points, and then go for knee replacement surgery. All the best.